3 million seniors just got forced off their Medicare Advantage plans in 2026. That's 500,000 from Humana alone. And if you're on TRICARE For Life and you're thinking about starting Medicare Advantage, make sure you watch this video. This video is going to save you a phone call to your kids in panic next October. I'm Theo Robeson with Patriot Senior Advisors. Let's break down exactly what's happening. I'm a licensed Medicare broker focusing on military, retirees, and veterans. What we're going to cover today is this article right here, the real numbers, why this is happening, and what it means for veterans specifically. Make sure you stick around till the end for a veteran-specific takeaway. Nearly 3 million seniors were forced off their plan in 2026. This article was based off a JAMA study from Johns Hopkins and Bloomberg School of Public Health in Georgetown. That's when your insurer either leaves your county or kills your specific plan. And for 2 decades, Medicare Advantage plans grew steadily into one of the most popular insurance choices in America for retirement. It's low premium. You get extra benefits like dental, vision, hearing. It's simple. There's a single bundled plan that all of your healthcare needs are basically attached to. And more than half of all Medicare, about 60%, Medicare, Johns Hopkins, Bloomberg School of Public Health in Georgetown, 2.9 million, that's 3 million Medicare Advantage enrollees were forced to disenroll from their plan in 2026, meaning their insurer either left their market or left their state entirely or disenrolled the plan. And 10% of all Medicare Advantage beneficiaries are impacted by this on the individual HMO and really on the PPOs too. For context, the average rate of forced disenrollment from 2018 to 2024 was 1%. It increased 10 times. It's 10%, and in 2025 it was 6.9%. And so it's not the same as just being able to switch plans during open enrollment. It's involuntary, and an insurance company exits a market, it terminates a specific plan. Every enrollee in that plan loses their coverage at the end of that year, regardless of whether or not you wanted to change. It's not your choice. Regardless how long you've been on that plan, regardless of whether or not you have health conditions that are specifically tied with that plan, and that's why you chose that plan. That's not normal. This has never happened before. So here's a couple things. 2 states entirely, Florida and Georgia, and North Carolina too. County coverage dropped from 89 to 85%, and 1,000 people were impacted. With United Healthcare, plans stopped being offered in 109 counties, and I noticed it a lot in Colorado. About 180,000 to 600,000 members were impacted, depending on how you count the PPO exits. They exited individual MA markets in Vermont entirely, and they cut the footprint in Minnesota, Kansas, and the Southeast. Aetna closed 90 plans across 34 states. Most were PPOs, the ones that give you more freedom, the ones that work best with veterans that like to travel, and Part D plans in 100 counties. And if you're on a Medicare supplement, that means that's your prescription drug plan. And it seems like the good plans are going away for sure. Star ratings, 1 to 5 stars. 4 stars and higher is considered the gold standard. Companies get paid based on Humana's percentage of members in 4+ star plans was 94% in 2024, 25% in 2025, and 20% in 2026. One of the largest contracts covering 45% of their MA members dropped from 4.5 to 3.5 stars in a single year. That's outrageous. Humana is suing CMS over it. They lost. They filed again. Now they're appealing to the 5th Circuit. They're losing $1 to $3 billion in bonus payments because of this. And enrollees, 28% were disenrolled. That's places like North Dakota, Wyoming, Montana, some places in Colorado where the disruption has been worst. Journal of American Medical Association, if you're in Minnesota, if you're in Vermont, Wyoming, South Dakota, Idaho, New Hampshire, Maryland, North Dakota, you probably felt it. The pattern cuts across geography. So basically, when your insurance is in court fighting the government over the quality of stores instead of just fixing the quality, what does that tell you? What does that say about them? The profits are what's important to them. So that's why you need an expert who has your best interest in mind. And the hospitals are leaving too. So Central Health in Virginia dropped MA in January. St. Luke's Health System no longer accepts Humana. Montrose Regional Health ended the Humana contract too. Kettering Health dropped Humana and Devoted. UNC dropped Humana, WellCare, and Cigna. Well, if you're at the Mayo Clinic, unless you have Minnesota, good luck getting help at the Mayo Clinic. Mass General Brigham, no longer in network with UHC or Blue Cross Blue Shield of Massachusetts. So more than 21 major hospital systems have walked away from MA plans this year. That's historic. It's never happened before. Why is this happening to you? Government reimbursements to MA plans fallen 20% since 2023. That means the government is giving these companies 20% less. COVID happened and people weren't as comfortable going to the doctor. People weren't as comfortable getting help. People weren't going outside. And COVID ended, people get more comfortable going to the doctor, and now you're costing the insurance companies more money. And if they're getting less money from the government, more money, that's less profit in their pocket. MedPAC estimated that MA cost taxpayers $76 billion more than traditional Medicare in 2026. Unprofitable counties, they cut benefits, they exit market. These companies sold seniors as a product they could only afford to deliver when the government was overpaying them. Now the spotlight tightened. They're walking away from the customers they recruited. And they recruited hard. If you're a veteran with TRICARE For Life, this is why it matters. A lot of veterans get sold on benefits, right? Dental, vision, hearing, these big givebacks. TRICARE For Life already wraps around Medicare as secondary coverage, so you're good on that end. When you join an MAPD plan, you have to make sure that it doesn't, and that's why you need an expert in your corner when it comes to the veteran stuff, who understands how TRICARE works. I'm licensed in 20 states. And now the carriers exiting the market are dropping hospitals, the shiny benefits. Your plan just might not be there next year. That's what they're doing. And there's a smarter play for veterans, an MA only plan that lets you keep TRICARE intact and get extra benefits without disruption. That's a whole other video. And if you want to know more about it, hit me up directly, theodore.robeson@yahoo.com. And just to close, to wrap it all up, 3 million seniors got disrupted. The biggest carriers exited, cut markets, hospitals are walking away, and there's a huge collapse in the Medicare Advantage field going on. It's not all bad. Medicare Advantage is still strong. The government still likes Medicare Advantage plans, is still paying these companies, but you, the consumer, are really starting to feel it. Don't be the guy in November who found out that your plan got killed and now you're scrambling trying to find help. Let me know. I can help. Find somebody local. They can help too. I'm licensed in 20 states. Odds are I can help you. Subscribe so the next video hits your feed. I'm Theo. Talk to you next time.